So why are we doing this? Why are these changes necessary? And that's because we are hemorrhaging money. We have a negative balance in our health fund of $2.3 million this year, estimated to be about $3.3 million by the end of this year. The changes that we made last year did bring in the amount of savings we were hoping they would bring in, but our costs have gone up considerably. Last year, or in the last newsletter, I put in links to the Time Magazine piece on healthcare costs. Now, I realize that is a long magazine article, but if you read even the first couple of pages of it, it gives you an idea of why our healthcare costs are going up so drastically. I really urge you to go back to that newsletter and click on the links to either the new Time Magazine article or the Jon Stewart interviews with the author to get more background on the healthcare costs. So last year, for the cost for the average annual cost for an employee in a PPO was $13,211. For an employee in the HMO, it was $13,035. And last year's annual cost for an employee in Kaiser was $10,235. So as we're going through trying to make the decisions on how to be equitable, how to take care of our employees, since Kaiser is the least expensive, we decided that would be our safety net for employees to an option for them if they felt they could not absorb the higher contribution costs.
One of the things to consider when we're talking about all of this is our health fund is what's called self-insured. So when somebody incurs medical bills, those bills come to the school district, and those are paid directly by the school district through the insurance company. And so we don't have anybody telling us how to modify our plan. We make the modifications. If we move to a trust or something like that, we would lose control. We're going to talk about that a little bit further down the line, but one of the things to really think about is all of these plan modifications are happening because we have the ability to do it. We can use a scalpel, as it were, rather than a chainsaw to make changes. One of the questions that we got in one of our presentations was, well, I've heard nothing but bad things about Kaiser. What do people think about it that are in it? And so we looked to CalPERS. They are one of the largest insurance pools in the state, and they do an overall satisfaction rating with their members in their insurance pool. These are the number of people that are enrolled in these health plans that scored an 8 to a 10 on a 0 to 10 satisfaction survey. So Kaiser was the highest over here, and PERS Care is a PPO pretty close to what we have now. A lot of teachers ask, what do other school districts pay? You know, I heard that my friend in Simi Valley has lifetime benefits and she doesn't pay anything. Well, this is what's actually being paid around our area. In Las Virgenes, for a family, their out-of-pocket contribution, and this is just for the monthly contribution that they pay, this isn't deductibles or copays, the minimum that they can pay for family coverage is $3,600 a year. The maximum is $32,000 a year. And no, we are not adding a number in there. That is the actual maximum amount of money out of pocket per year just for the premium for these plans. This plan right here, PERS Care, is the one that they would spend $32,000 out of their own pocket. Their two-party minimum out of pocket, that's for a real base plan, and this is for medical, dental, vision, is $1,000 per year, and the maximum is almost $25,000. The single person minimum out of pocket is nothing, and their maximum for that platinum plan is $12,500. Over in Oak Park, they have a cap. Las Virgenes also has a cap. And the way a cap works is the school district says, we will pay X amount of dollars, and anything that you want for insurance that goes above that amount, you have to pay for out of your own pocket. And so for an Oak Park teacher, a single person, the district is saying, okay, we will contribute $7,300 to your health care plan. And so if you pick a plan that's an HMO and low cost, your out of pocket can range from $0 to maybe a couple $100 a month. If you're a family, the cap is $16,400, and your monthly out of pocket can be as high as $648 a month, and that's to choose from a very good plan, a platinum plan. Simi Valley, they are self-insured like us, and they charge $75 a month for an employee plus one, and that is a child or a spouse. They don't differentiate. That's $150 a month. An employee plus two or more is $225 a month. But they're looking at the same funding losses like ours. One of the things to consider is all school districts are working with a finite pool of money. And as a result, we've had to make cuts in different places. Some school districts are taking furloughs, some have higher class sizes, some have done layoffs in order to cope with those cuts. And the healthcare group that meets decided that furloughs negatively impact your retirement in the long run, and that by doing the increases to healthcare costs would be a lot better than impacting your retirement in the future. This is a national trend of healthcare costs. This comes from the Kaiser Family Foundation, not associated with Kaiser Permanente. $360 a month is what the average employee in the country pays for family coverage, and $80 a month-ish, $79 a month for single coverage. And this is public and private employees. This is nationwide. This is another way of looking at those healthcare costs. The orange bar is how much the employee pays for family coverage down here on this, and the blue part is how much the employer contributes to the plan.
So we understand that we're asking you to make some pretty big decisions, and so the district has agreed to open the enrollment by 2 additional weeks. You'll have May 1st through June 14th to sign up. There's still time to sign up for the Flex 125 spending account to pre-tax the monthly contribution. You must sign a paper agreeing to pre-tax your contribution in order to get the tax savings. What that does is allows the district to separate out the cost of your monthly contribution. It comes out first, and so you are not taxed on that. That's what we mean by pre-taxing it, and that saves you money by reducing your taxable income. If you have not done this and you're interested, we've put Kevin's email there for you to contact him, and they can arrange for that. If you've already enrolled for your Flex 125 plan next year, you can make the modifications due to these changes. The Flex 125 spending account with the rebates for your co-pays and other medical expenses is a separate thing, and you can talk to Kevin about that as well. But we want to make sure that everyone pre-taxes this monthly contribution. It doesn't cost you anything to do it, and it will save you money if you pre-tax this money. So why aren't we going into a trust like a California Value Trust or CalPERS? We did investigate this. This committee, the Health Benefits Committee, investigated all kinds of ways of saving money. And what happened is that they didn't want us. And they didn't want us because they felt that they couldn't save us any money. That the plan that we have with our healthcare experience is the best, that they could not improve upon that. So we wouldn't have saved money even if we did get into their plan. The other thing to remember is that when you're in a trust, you lose control. We wouldn't be having these discussions. They make the changes. If costs increase, they increase, and we just have to deal with it. Also, remember on the past slide in 09-10, we had a really good year of risk experience. So we kept those savings. When you're in a trust, you do not get those savings. It's absorbed into the trust. So back to, will we be here in the future? Probably. As I said, the healthcare industry is an entity unto itself, and the costs are going up. We don't see any slowing of healthcare increases in sight. As far as the American Affordable Care Act, these costs are, we're still dealing with the regulations there, and hopefully with the emphasis on wellness care and taking care of things early on, we will see changes in the future, or realize some cost savings in the future, but at this point we're not seeing much.
So what if we say no? The negotiations process is what we're going through right now. Each individual association has to vote on these proposed changes, and if we say no, we have to go back to negotiations and go through the impasse process. And that is set up by state law. And what would happen is, in impasse, a mediator would be called and would try to reach an agreement between the two parties. If we couldn't reach an agreement, then we would be certified to fact-finding, and a fact-finding panel would issue a report that the school board would take a look at. And if then the school board would have the ability to either impose changes, and if they did, we would have the ability to go on strike, or we would just live with the imposition of what they put in place. So that's ultimately what could happen if we say no.
So what if we cut somewhere else to get the money? Well, basically, where do we cut? We've been pretty transparent with our school budget and knowing where the money is going. Again, this is one of the things that we had to struggle with. Is it better to try to get more money on the pay schedule and to regain our furlough days, or to take that money and put it into the healthcare costs? The district has contributed $600,000 a couple of years ago, and about another $500,000 this year, over and above what they normally contribute, as a way of offsetting some of those costs. And we have taken the position that we would rather have the money on the salary schedule and try to regain our furlough days. We may have to have further discussions in the future. What about Prop 30? Well, Prop 30 stopped the cuts, further cuts from happening. And as we pay down the debt in the state budget, it will add more, make more money available in the future. There may be some things in the future, as we come into bargaining with the May revise and the budget process, we may be asking you to call legislators. So please be on the lookout for that. And if we ask you to make phone calls with the talking points, please do so. But at this point, Prop 30 is not helping as far as making more money available for the healthcare costs. So what can we do? One of the things we can do is be a better consumer of healthcare. We recently you received an email about the costs of going to the ER as opposed to going to urgent care. And those are the types of decisions that can help you not only save money, but save time. Anthem 360 is a wellness program that is part of our healthcare program. It's not a scam. It's a disease management for high-risk issues. If Anthem sees that you have some issues like diabetes, asthma, whatever, they may call you and offer you extra help on how to manage your health care. So again, this is not a scam. They are here to help you out. It is completely voluntary, but you may find this information to be quite helpful. There's a Future Moms program for pregnant women, but you must call in, and they don't contact you, you contact them, and there's a nurse at the other end of the line that can help you out. The nurse line is the number there, 800-337-4770. Other folks can use the nurse line too if you have questions about your health care and you just need a quick question answered, or you're not sure if you need to go to the doctor or not, or is this something serious. You can call in and get that information from the nurse line. Kaiser has after-hours advice at the number listed here. You may also go online and email your doctors there. And then Kineo Cares is for everyone. It's our wellness program that we have here in the district. We brought you Mix It Up earlier with the vegetables and the Know Your Numbers, and we just encourage you to take part in that.